So Beth Wiseman is here from the CAMHS service. So although, as I said at the beginning, a lot about today was creating awareness of other services that are out there and kind of taking some of the pressure off CAMHS and helping young people to access other services that might be quicker, easier, more suitable, etc. than CAMHS. I feel it also helps to have a bit of an understanding of CAMHS and what they are there for and not there for and so on, and to sort of help us to kind of get a bit of context around that landscape. So, and then we'll have time for your questions afterwards.
Hi everyone, I'm Beth Wiseman, Specialist Children's Services Manager. Beth Wiseman, Specialist Children's Services Manager. CAMHS is Child and Adolescent Mental Health Services, and across Glasgow there is 4 CAMHS teams in the north, the west, the south and the east. We are a multidisciplinary team and we offer assessment and intervention for children and young people from the ages of 0 up to the 18 who are experiencing moderate to severe mental health difficulties. Our CAMHS teams are largely made up of nursing and psychology. It will sound as if we have really large teams when I tell you that we have nursing, psychology, psychiatry, family therapy, occupational therapy, speech and language therapy, psychotherapy, and we've just introduced healthcare support workers. But if I to then say to you that actually we've only got 1 family therapist in each team, we might only have part of an occupational therapist that's shared across a couple of teams. We've just increased speech and language therapy into CAMHS. We have access to psychotherapy, and as I say, healthcare support workers are a new addition to the team. So though in first take, it looks like, yes, we do have quite a lot of staff, it's actually not in the broader scheme of things. So thinking about what does CAMHS actually do? If you look at the slide that's up there just now, it says that we are there to see moderate to severe emotional behavioural problems. I'm not going to read it all out to you, but we are there to see young people that are at the moderate to severe end of the scale. So people that are experiencing things that are impacting on their day-to-day life round about their mental health. So things that like severe depression and anxiety, mental health disorders. It's not always about getting a diagnosis, it's about actually what interventions can be provided round about their mental health. We have found over the last couple of years that actually the understanding of CAMHS has been varied. People think that CAMHS is C-A-L-M-S, that it will come to calm them down. So sometimes when families are referred to CAMHS, they're not sure what they're coming and what to expect from our service. So that's not just from families, it can be from referrers as well. So just understanding that it's for a moderate to severe mental health problems is what the CAMHS service is for. On first appointment, we do provide an initial assessment, and at that point we will have a care plan that is co-created with the family and the young person. At that first appointment, the assessment is carried out, but the initial treatment might not happen straight away. I'll come back onto that in a little minute. Over the course of the pandemic, we introduced we were forced to move into the new ways of working, virtual, using Attend Anywhere, which was mentioned in the last presentation. We hadn't used Attend Anywhere or virtual appointments. All our appointments had been clinical based, face-to-face appointments. So we're now offering a combination of virtual, telephone and face-to-face appointments, which has proved to be successful because virtual doesn't work for everybody, but face-to-face doesn't always work for everybody either. So we've got a good blend of appointments that we can offer. Coming into the service, you have the options of urgent and routine. So if a referral comes into our service and it's been classed as urgent, then it will be seen either the same day or within 7 working days. The routine appointments does vary. It depends on the complexities and the reason for referral. As Barbara has said right at the very beginning, we do have waiting lists. There is a lengthy wait for routine assessments and for intervention. Now, part of the issues round about that is previously we had accepted all referrals that came our way. Not all referrals that came to us were appropriate. And again, I'll come back to that. So any referral can come from any professional that knows the young person best. 80% of our referrals come from GPs. Families will go to the GP and say, can I have a referral to CAMHS because I'm worried about Beth. I'm worried that she might have ADHD, or Beth's not managing at school. I'm really struggling to get her to school. Can I have a referral? And the GP will make the referral to CAMHS because maybe they don't know where else to signpost the family to. So we have been doing a lot of work with all our referrers to help them understand that they can make referrals straight to us. It's a myth that the GP referrers will come in a quicker fashion and be processed in a different way. All referrals are processed in exactly the same format. All we ask is that you have a full description of actually why do you think they need to be referred to us? What has already been tried? Is there any other services already involved? And what's the expectation of the CAMHS intervention? And consent is a really important thing as well, because some of the referrals that we receive, the young person hasn't been consulted. It's the family or the parents that have turned up to the GP and had said, I'm really concerned about Beth. Can you make a referral, please? And so 14-year-old Beth turns up at an appointment and says, well, I didn't want to be here. I don't think that there's anything wrong. Or I'm seeing the school counsellor. I don't want to come and talk to somebody else. Or I've got a worker at Bernardo's. I don't need anything else. So having spoke about the criteria that CAMHS have set out of what we would expect to come into our service, what you see now is a list of referral reasons that we pulled out from an analysis that we done on our waiting list review. Some of them absolutely, you would say, yep, that would come into a CAMHS service. But some of them you would hear just even from the presentations earlier on, don't actually need to come in to a specialist children's service. Bereavement support, school refusal, chronic headaches, bullying, chronic insomnia. What was key when we looked at these reasons for referral is that there wasn't much information. We had no idea of how debilitating the problem was for the young person or the family, how much it was actually impacting on their life. Was it actually that one day they went into school and they decided not to participate in some of those activities? Or was it something that had been happening over the last 6 months that actually there had been a trigger that they weren't sure what it was? So we actually didn't have any of the detail. So what we've been really wanting to do is actually, whoever knows that person best, whoever knows that young person best, if you're not sure if it needs to come into CAMHS, if you're not sure where the best service might be, then actually call CAMHS and speak to us. Have that conversation rather than just putting in a referral. Because sometimes what happens is referrals get put out to lots of different places. It can get put out to CAMHS, it can get put out to the youth health service, it can get put out to school counselling in the hope that actually, we know CAMHS has got a long waiting list, but actually it can get picked up somewhere else maybe quicker. But actually maybe one of the other agencies that's been referred to is actually the most appropriate place. But all of a sudden CAMHS's waiting list is growing because actually it's been sent in that shotgun approach to everybody. So some of the places that CAMHS will signpost to, either after we've had that first assessment and we've thought actually this isn't the service for us, or actually after we've provided some intervention. Now, I've just put some here that the teams have mentioned to me. This list is absolutely nowhere near exhaustive, and hasn't mentioned all the places that we've spoke about today. Some of the things that come up, sleep can be a really big concern for families, and there's work currently ongoing between the Tier 1 and Tier 2 services and specialist children's services at the moment. What we're really wanting to make sure is that actually there isn't any wrong door for families, that people get to access the right help at the right time. And I think that just now families end up going to lots of different avenues, so we're not wanting them to have that wait. We're wanting to make sure that that first point of contact, that they get signposted to the correct support that they need.
2 minutes, Beth.
Again. We are really striving, I think that the whole point of today as well is about having that better collaboration between professionals so that we can actually work together and understanding what's in our system, and for families as well, so that their expectations of what's in CAMHS, we won't have the fairy dust, we don't have the magic answers at the end of it. What people are being provided within all the services that have been discussed today could be actually what's good enough. What is being provided in CAMHS might not be what's right for them, but it's actually about how we can discuss together what would be right for the families within our communities. What I've got here is the numbers of and email addresses of the 4 locality teams. It is good to talk. So if there is any questions that you do have about any young people that you may have that you think are on the waiting list, that you think our referrals would be useful, then have the conversation with them, work out whether it would be or if another service might be a better option for them. Thank you for listening.